So for me, success is when we can have broader solidarity across the global health community to work on prevention for non-communicable diseases like cancer, because we know that they can be prevented. We know the risk factors, harmful products like tobacco, alcohol, sugary beverages, lead to cancers, and we know that 50% of cancers are preventable if we reduce consumption of these harmful commodities. The other thing we know is that health taxes, by increasing the price of tobacco, sugary drinks, or alcohol by only 50%, we can save 50 million lives by 2050. We can also generate revenue, $3.4 trillion globally. And that can be used to fund health budgets and help governments support the services that they need for their population. So I think that the answer to that is we actually need to verify those claims. Tobacco industries may tell us that they are bringing jobs or they're helping the economy, but when you actually look at the data, it doesn't stand up to scrutiny. And when you look at the experience of countries that have taxed tobacco, you don't see an impact on the economy. In fact, you see a positive impact on the economy, because you are making people healthier, they're able to work longer, they're able to be gainfully employed, and they're able to contribute to the economic development of the country. So Vital Strategies has a number of different partnerships and collaboration with Bangladesh, with government of Bangladesh, on a number of things. One big area is road safety. Road injuries, cause a lot of death. And so we work very closely with all of the different ministries, that are involved in road safety. Whether it's doing campaigns, for helmets, for motorcycle use, or to reduce speed limits, so that we are reducing crashes and deaths from crashes. So that's one area where we work in Bangladesh. Another area is around the tobacco control. Bangladesh has a high prevalence of smoking, and so we know that if we do reduce the use of tobacco in the country, we're going to be saving a lot of lives from preventable cancer deaths. And the third area that we work or we partner with government in Bangladesh is around data. We work closely with government to support building and strengthening data systems, and then analyzing that data and using it to inform policy development and policy formulation. So government has the tools and the information they need to make the right decisions for their people. So we haven't started cancer registry work in Bangladesh. I think what we want to do is raise awareness that cancer registry work is happening in many countries and it can be strengthened, that there are positive outcomes to cancer registries, and raise awareness of this so that more countries are investing in cancer registries so that they have the data to design their national cancer control plans. So my solution is let the data tell us what we should be focusing on. And let's make decisions around what is the greatest need. What are the issues that are killing the most people or that are causing disease for the most people, and where are the places that we can actually make a difference in a cost-effective way. So WHO has recommendations for what they call the best buys. So these are things that governments can do to save lives that have very high return on investment. So if you spend $1, you'll get like $7 back in healthcare savings and economic productivity for these WHO best buys. And amongst the best buys are tobacco control, health taxes, as I mentioned, and other preventative recommendations as well.